Did you know that silent heart attacks are more common than you think? That's right, a heart attack doesn't always mean sudden crushing chest pain. In fact, many people experience mild or even no symptoms at all, which is why it's crucial to be aware of the more subtle warning signs. In this video, we're going to discuss the top 10 warning signs of a silent heart attack that you should never ignore. We'll talk about why these symptoms occur and what you should do if you experience them. Remember, knowledge is power when it comes to your health. So, stay tuned, because what you don't know can hurt you. Let's dive in and empower ourselves with the information we need to protect our heart health. We all experience fatigue from time to time, but have you been feeling unusually tired lately, even after a good night's sleep? This persistent fatigue, especially if it's new or doesn't improve with rest, could be a sign of a silent heart attack. When your heart isn't pumping efficiently, it has to work harder to circulate blood throughout your body. This extra strain can leave you feeling drained and exhausted. If you're experiencing unusual fatigue, especially if it's accompanied by other symptoms on this list, it's crucial to pay attention to your body and consult a doctor. Don't brush it off as simply being too busy or getting older. Early detection is key when it comes to heart health. Experiencing shortness of breath, especially during activities you normally handle with ease, can be alarming. While it can be attributed to various factors, it's crucial not to dismiss it when it comes to your heart. Shortness of breath can indicate that your heart isn't pumping efficiently enough to deliver adequate oxygen to your body. This can occur even without chest pain, making it a particularly concerning sign of a silent heart attack. If you find yourself gasping for air more often, even without exertion, it's essential to consult a healthcare professional. They can assess your individual situation and determine if your heart health is a factor. We've all experienced indigestion or nausea at some point, often attributing it to something we ate. However, these seemingly common digestive issues can sometimes signal a more serious underlying problem, like a silent heart attack. When blood flow to the heart is compromised, it can trigger nausea and indigestion. This occurs because the digestive system isn't receiving the adequate blood flow it needs to function correctly. While indigestion or nausea alone shouldn't cause immediate alarm, it's crucial to be mindful of their frequency and severity. If you experience these symptoms persistently, especially alongside other warning signs on this list, seek medical advice promptly. Discomfort in the chest, back, or arms. While chest pain is a well-known heart attack symptom, discomfort can also manifest in less obvious areas like the back or arms, especially in women. This discomfort might feel like pressure, tightness, squeezing, or a dull ache. This happens because the nerves that transmit pain signals from the heart and those from other areas in the chest, back, and arms can sometimes overlap. As a result, your brain might misinterpret the origin of the pain. Don't dismiss any unusual discomfort in these areas, even if it doesn't feel like the classic Hollywood heart attack. It's always better to err on the side of caution and seek medical attention. Lightheadedness or dizziness. Feeling lightheaded or dizzy can be disorienting and concerning. While it can stem from various factors, it's essential to recognize its potential link to heart health. When your heart isn't pumping effectively, it can lead to a drop in blood pressure, reducing blood flow to the brain and causing dizziness. This can occur suddenly and without warning. If you experience lightheadedness or dizziness, especially if it comes on abruptly or is accompanied by other symptoms on this list, seek immediate medical attention. Don't try to tough it out. Your health is paramount. Sweating. Breaking out in a cold sweat without any apparent reason, such as strenuous activity or hot weather, can be a red flag for a silent heart attack. When your heart is under stress, it can trigger your body's fight or flight response, leading to sweating, even if you don't feel physically hot. This is your body's way of trying to cool down. If you experience sudden, unexplained sweating, especially if it's accompanied by other symptoms on this list, it's crucial to seek medical attention immediately. Swelling in the legs, ankles, or feet, also known as edema, can be a sign of fluid retention, which can be caused by a heart that's not pumping efficiently. When your heart isn't pumping effectively, it can cause a buildup of fluid in your lower extremities. This swelling might be painless, but it's important not to ignore it. If you notice persistent swelling in your legs, ankles, or feet, especially if it's accompanied by other symptoms on this list, consult a doctor to determine the underlying cause. Irregular heartbeat. Your heart should beat in a steady rhythmic pattern. If you notice your heart suddenly racing, fluttering, or skipping beats, a condition known as palpitations, it could be a sign of a heart issue, while occasional palpitations can be harmless, especially if triggered by stress or caffeine. Frequent or prolonged episodes should never be ignored. If you experience irregular heartbeats, especially if they're accompanied by other symptoms on this list, seek medical attention promptly to rule out any serious underlying conditions. Sleep disturbances. We all experience occasional sleep disturbances, but persistent trouble sleeping, especially if it involves waking up feeling short of breath, could be linked to your heart health. When you lie down, fluid can shift towards your upper body, putting extra strain on your heart if it's not pumping efficiently. This can lead to shortness of breath, making it difficult to sleep through the night. If you consistently struggle to sleep or find yourself gasping for air in the middle of the night, don't hesitate to consult a doctor. They can help determine if your sleep disturbances are related to your heart. Jaw or neck pain. While jaw or neck pain is often associated with dental issues or muscle strain, it can also be a surprising symptom of a silent heart attack, particularly in women. This referred pain occurs because the nerves that supply the heart and those that supply the jaw and neck share pathways. As a result, your brain might misinterpret the origin of the pain. Don't dismiss any unexplained pain in your jaw or neck, especially if it occurs alongside other symptoms on this list. It's crucial to seek medical attention to rule out any cardiac events. Your heart health matters. So, there you have it. The top 10 warning signs of a silent heart attack that you should never ignore. Remember, these signs can be subtle and easily dismissed. But early detection is crucial when it comes to your heart health. If you or someone you know is experiencing any of these symptoms, don't ignore them. Seek medical attention immediately. Your heart health is too important to take lightly. Thanks for watching, and don't forget to like, share, and subscribe for more health tips.